Hello, I'm Dr. John Bedolla. I'm Assistant Professor of Medicine and I'm also the Director of Risk Management for a large EM group. One of the reasons I like MDCalc is that it gives you actionable information that you can use in clinical practice, and it seems to be very well vetted and have a really robust process for adding apps. I'm talking with Dr. Joe Habboushe today and getting some insight into MDCalc. So Joe, how is it that you add content to MDCalc?
Yeah, excellent question. MDCalc is 11 years old. It was started by my partner, Graham Walker, when he was a med student, and he first just put a few scores on a website. I joined him a few years later, and we've developed a process since then. So number one is we pick scores that are well validated and well accepted. But after a few years, our users asked us to start developing the content around the scores that would help them use it better. So we do that in two ways. We reach out to two different types of experts. Number one is the creator of the score themselves. So Phil Wells for the Wells criteria, Graham Teasdale for the GCS score, Ian Steele for the Ottawa and Canadian scores. And they can write a section for how you can use the score best. But we also have another expert who's unbiased to give a evidence-based synopsis of the score, when to apply it, when not to apply it, after you get the score, what to do next. All things that will help the user, the physician, apply the score best so that they can help the patient best.
And what's new on the horizon?
There's so many new things in this past year and this coming year for us. 3 years ago, we had 80 scores on MDCalc. Now we have over 250. And in this coming year, we will likely add a few hundred more. This is going across most fields of medicine. We're actually used now by over 50% of US physicians each and every month. It's one of the most broadly used medical references in the US. Besides adding new calculators, we've actually developed, of course, the iPhone app, and we're about to launch an Android app. And this year, we're starting to work on much better and seamless EHR integrations.
You also seem to have a novel process where you don't just look up the app, you look up the chief complaint.
Yeah, so we have a new functionality in our new website, which we just launched last month. Our users were asking us, how can we learn about new scores that we don't yet know about? It's a good question. How do we learn about these scores? You either learn about it in residency or through a colleague. So we developed this new type of searching functionality where you can present the clinical scenario into MDCalc and learn about the scores. For example, if a patient comes in and you're worried about PE, you can click PE and diagnosis, and you'll see the Wells score, Geneva score, PERC rule, and explanations on how they're different. After you diagnose PE, you can click on PE prognosis, and then you'll see a whole new set of scores that will help you prognosticate the PE and help you figure out how to best treat it. Do they need to go in the ICU? What kind of medications? Those are scores like the PESI score and a few others.
Excellent. Thank you very much.